Welcome, everybody, to another KVDL webinar series. My name is Dr. Greg Hansichek. I'll be the moderator for today. A special thank you to everybody that has joined us in our previous webinars. Big thank you to those that are joining us for the first time. And for those of you that are new to the way we work our webinars, just a little bit of housekeeping things. Number one is that please send your questions in through the chat or the Q&A at the top of your screen there. And then at the end of the presentation, we'll get through as many questions as we possibly can. The other thing is you will receive 1 hour of CE if you stay with us for this entire webinar. Give us about 2 weeks to get you the certificate, but we will send that to you via email. The other thing you will receive from us after the presentation in the next few days will be a survey, kind of just grading us on what we did well, what could have been improved. And then one of the most important questions we ask that we hope you answered is, what topics would you like to see us actually offer in the future? And because we are the diagnostic lab, it would be topics that have something to do with diagnostics, not so much with treatment and those kind of things. And I think with that, it's my great pleasure to introduce Dr. Kamilyah Miller, who's our special guest today. Dr. Miller is a native Floridian. She received her DVM from Tuskegee University and then spent some time as a small animal practitioner in Las Vegas, Nevada. And then after a small animal career, she decided to follow her heart, which is parasitology. And she came back to K-State and received her PhD here at KSU. And we were lucky enough that when she finished that up, we asked her to stay. And we were lucky enough that she agreed to stay on. And so she now is the section head for parasitology. She's got a very large service component, and she's very, very active in research. And her research, even her PhD, was looking at Echinococcus and particularly coyotes in the Midwest. And now she's still interested in Echinococcus in other species. And we're very, very fortunate to have her as part of the Kansas Veterinary Diagnostic Laboratory. So with that, Dr. Miller, I'll turn it over to you.
All right. Thank you, Dr. Hansichek, for that introduction. So yes, I am Kamilyah Miller, and today we're going to talk about Echinococcus tapeworms from Canada to Kansas and where to next. So an outline for what we're going to chat about today. So we're going to talk about Echinococcus species. We're going to talk about where we found them in North America, specifically in Canada and the United States, and then chat a little bit about my research and where we found it in the coyote species in the Midwest, United States. And then we'll chat about diagnostics, treatment, and prevention as we walk through a case that we've had here at the KVDL. And then we're going to wrap everything up with some big takeaways, some acknowledgments, and then answer some questions that you all may have throughout the presentation. So let's chat about tapeworms, one of my favorite types of parasites. So Echinococcus falls in a tapeworm family called the Canidae tapeworm family. And they have definitive hosts as dogs and cats. They have a worldwide geographic distribution. And the interesting thing about this tapeworm family is that all of the tapeworms produce what we call a Taenia type egg. So it's here to the left of your screen. So the Taenia type egg is brown, like a light brown to a dark brown color. It has a really thick brown, thick shell that has some striations in it. And then all tapeworm eggs have hooks, and they have what we call a hexacanth embryo, which is just a fancy term for a tapeworm larvae. And these eggs are kind of small, around 30 to 40 micrometers. But the most important thing is that because all tapeworms within the Canidae tapeworm family produce Taenia type eggs, it's really difficult just by looking at this egg to be able to say if this egg came from a Taenia species tapeworm or an Echinococcus species tapeworm. So I mentioned earlier that we have different Taenia species and Echinococcus species that produce Taenia type eggs. And so these are the tapeworms of dogs and cats that produce Taenia type eggs. So our most common tapeworm, Taenia species that we find in dogs in North America is Taenia pisciformis. And then our most common Taenia species of cats in North America is Taenia taeniiformis. And I make that distinction between Taenia species and Echinococcus species because Taenia species like T. pisciformis and T. taeniiformis are not infective to humans. However, we've got Echinococcus species like E. gran and E. multi that do infect cats and dogs that are zoonotic to humans. So when we think about how we diagnose tapeworm infections, we normally find perglottids in the feces. And so some of those common tapeworm perglottids that we can find are Dipylidium caninum, often referred to as the flea tapeworm or the cucumber seed tapeworm. Mainly the flea tapeworm because it uses fleas as the intermediate host, cucumber seed because the perglottids are shaped like a cucumber seed, and they have bilateral genital pores. And when we think about Taenia species, they're different from Dipylidium in that they're more rectangular in shape. The mature perglottids are translucent, so we can see some of the internal structures. And then instead of having a bilateral genital pore, they just have one genital pore where they can release eggs. Now, this is a piece of the adult tapeworm, right, for Dipylidium and Taenia species. But the difference in the adult size for Echinococcus is that it's very small. So whereas for Dipylidium and Taenia, we can have tons of perglottids that are attached, that are a part of a larger tapeworm, this is the entire size of the Echinococcus adult. So it's very, very, very small. And make that distinction because these perglottids we can see with the naked eye. We can't see Echinococcus perglottids, let alone the whole adult, with the naked eye. So diving deeper into the world of Echinococcus, we've got two species that we find here in North America. We've got Echinococcus granulosus, or E. gran, because that could be kind of a tongue twister for the remainder of the presentation, and then Echinococcus multilocularis, or E. multi for short. So we'll start with E. gran, and E. gran is a genotypic cluster made up of different genotypes, and the two main genotypes that we see cycle through the United States and even North America is E. gran sensu stricto, which has more of a domestic life cycle, and so we find that domestic dogs as a definitive host and sheep as the intermediate host. And then we have E. canadensis, which has more of a sylvatic or wildlife life cycle, where it uses wolves as the definitive host and wild ungulates such as moose and elk as the intermediate host. Now, accidental ingestion of Taenia type eggs by humans or even other domestic dogs can cause a condition called cystic echinococcosis. And we call it that because of the type of cysts that they form, which are unilocular hydatid cysts. And I love this cross-section of this infected liver because it really gives us a chance to appreciate just the type of cysts, like the structure of the cysts that they form in these infected organs. So this sort of mimics a space-occupying lesion. So if you could imagine a balloon that you fill with air and it gets bigger and bigger and bigger. And so think about this lesion filling up with fluid and getting bigger and bigger and bigger, causing necrosis in the infected tissue organ and the surrounding tissue. And this is a big problem I mentioned earlier. It uses sheep as the intermediate host. And so think about if you go to slaughter this sheep and you see that there's cysts in the liver, right? You can't really pass this on for human consumption. I mean, you can eat it if you want, by all means, go for it. But you can't really put this out, you can't really send this out for human consumption. So it gets tossed to the dogs as offal or offal. I never know how to pronounce that word. And so the dogs ingest this, right? And so this is how that life cycle passes. But then also seeing the cross section, you can really appreciate just how damaged this liver is, and so it can lead to production losses as well. So life cycle. Can't be a parasitology presentation without a good life cycle slide. So we're going to start at number 1, where we have adults that live in the small intestine of the definitive host, which is the domestic dog. And those adult tapeworms are going to release eggs that are then shed in the feces of the domestic dog. Then those eggs enter the environment. The sheep picks them up while they're grazing, and then the oncosphere larvae, or the tapeworm larvae, is then released in the intestines of the sheep. It penetrates the intestines and travels to the liver or the lung and produces these unilocular hydatid cysts. And then we chatted previously where that sheep gets slaughtered, those infected organs get tossed, the dog picks them up, and those intermediate stages are then released to develop into adults in the small intestine and then shed eggs in the feces again. Now, I also mentioned that humans can be infected with this. So, accidental ingestion of Taenia type eggs from the environment is how humans would contract this disease and develop cystic echinococcus. Important to also note that these eggs are immediately infectious. This thick shell allows for the larvae to survive in the environment for up to a year inside of the egg in really harsh conditions. So, it's important to note there. So then E. multi, which I like to say is the scarier of the two Echinococcus species, uses wild canids such as red foxes and coyotes as a definitive host, and then uses rodents as the intermediate host. And after accidental ingestion of eggs by Taenia type eggs by humans or domestic dogs, they develop a condition called alveolar echinococcus. And again, I love the cross section of these livers to really show the different nature's structural changes that are different between the two cysts. So these are multilocular or alveolar cysts that develop mainly in the liver. So for E. gran, while we had cysts that mimicked a space occupying lesion, so they just get larger like a balloon, these more so mimic an infiltrative cancer. So what happens is part of the cyst, the growth part of the cyst, will actually extend out and create finger-like projections into the infected organ. So here's the liver. And then you get all this branching and budding. And I like this because it also just goes to show this the destructive nature that this cyst causes, that these cysts cause more so than an a unilocular hydatid cyst caused by E. gran. So, whereas you could potentially remove a cyst caused by E. gran, you can't really do that when it comes to alveolar echinococcus just because of, again, the infiltrative nature that more so mimics metastatic cancer. So life cycle is the same as E. gran. We just swapped out the definitive host for a red fox instead of a domestic dog, and the intermediate host is a rodent instead of a sheep. But we're going to start at number 1, where it's the same. We've got adults that live in the small intestine of infected wild canids. They release eggs, and they're shed in the feces of the infected canid. And then those eggs are picked up by the rodent, where the tapeworm larvae is released, travels to the liver, develops into alveolar hydatid cysts, and then that infected rodent is predated upon and ingested by a wild canid, and the intermediate stages then develop and mature into adults in the small intestine and then shed eggs in the feces. And so again, humans become infected by accidental ingestion of these infectious Taenia type eggs. And I've done quite a few of these CE talks. I've met with even a few coyote trappers, and they say, well, doc, I'm not eating poop. Like, how am I getting infected? And I say, well, I agree. I'm not eating poop either. But I've worked with trappers that say they use coyote scat as an attractant. And so I have a trapper that said, well, I just pick up coyote scat with my bare hands if I see it. And I was like, yeah, so that's something we don't want to do. And let's say we're gardening and you happen to have a visit by a red fox and they leave you a little fecal present, and happens to be, their feces happens to be infected with Taenia type eggs. And so now it's in your soil. You garden without using gloves, you don't wash your hands, and then your hands contact your mouth. And so now you've got transmission of Taenia type eggs. So, those are just some ways in which accidental transmission can occur. And this is my baby boy, Toby Mac. Dogs can also serve as a definitive host for this parasite too. So if you've got a dog or a patient that likes to predate on rodents, they are at risk of contracting this zoonotic parasite. And so putting them together, right, we talked about that both of these tapeworms fall within the Taenidae tapeworm family and produce Taenia type eggs. And so, and I also mentioned that dogs can be a definitive host for both E. gran and E. multi, but they can also be an intermediate host for both of these parasites as well. And so if a dog likes to predate on rodents, then they can get adults in the small intestine and shed eggs in the feces. But if that dog likes to chow down on some poop, then they can accidentally ingest these Taenia type eggs. And instead of the adults in the small intestine, you would actually get cysts in the liver. And the problem with that is these cysts are slow growing in our domestic dogs. And so we don't know that they've been infected until it's at least 1 to 2 years down the road, as those cysts have developing in the liver. And sometimes we catch them and it's already too late. So here are some other, I like to show this one because this is a unilocular hydatid cyst in the pectoral muscle of a human. And so again, after accidental ingestion of eggs, and the tapeworm just set up shop in a pectoral muscle. And so this is a cross section of that. And then we can see just what those hydatid cysts can look like on the surface level for egran. And then we can appreciate a more cobblestone appearance for our surface level view of what alveolar echinococcus can look like in the liver of infected rodents. So now let's talk about where we've found this parasite in domestic dogs, wild canids, and even humans, and in some intermediate hosts as well. So we'll take a look at the entire view of North America, involved some portions of Central America as well. And this is an older map from 2017. We're working on putting together a new one as more reports and surveillance is being done. But we find that it's largely unsurveyed. We've got some high percentages in Alaska, which we'll talk about, and Canada. Take a closer look at Canada. We've seen an explosion of cases in Canada, not just in domestic dogs, but also in humans as well. With one summer, I spoke with a colleague in Canada that said they saw as many as 8 cases, human cases, in a span of 2 months in one area in Canada. So Canada has really seen an explosion of cases, again, not just in domestic dogs, but in humans as well. And that explosion has been followed up with wild canid surveillance, where they've also seen a high prevalence in their coyote population as well. So now let's take a look at the US. This is where we all live. This is probably the area where we care about the most. So again, taking that zoomed out view of North America and honing in on the United States, we have I call it a classic case, or a historical case, of 1977, of a woman that had a history of fox hunting as a child, that was diagnosed with human AE. She had cysts in her lung, and that was in 1977. And then all of this gray shaded states here was wild canid and intermediate host rodent surveillance that was done in the late 1990s, early 2000s. So again, we see pointed out Alaska, on St. Lawrence Island, there was a lot of domestic dogs and wild canids that were positive. And then when we look at the contiguous US, we see that Nebraska and South Dakota, we've got some high prevalence there, followed up by North Dakota, Wisconsin, Illinois, Indiana, and Ohio, that also has some high prevalence as well. So, and we'll see Kansas, where we are right now, is white. And that is because there was a study done in the early 2000s where they were looking for E. multi in the wild canid population. So they collected 111 coyote carcasses and went looking for this parasite, E. multi, and didn't find it. So that was in the early 2000s. And I want to put a pin note there because we'll come back to that later. So then after that, we didn't hear anything beyond that surveillance in the 2000s. There was no case reports. There wasn't really anybody kind of looking for this parasite, because we kind of thought, well, it's just in the northern Midwest United States, and we just kind of forgot about it until 2018, when a dog in Virginia was diagnosed with alveolar echinococcus, so cysts in the liver, in 2018 in a domestic dog. And then that was followed up by another case in Missouri, again, where they've only had case reports before. We have another case report of alveolar echinococcus in a domestic dog, in a 10-year-old boxer, I believe. And then that's followed up a year later with a 17-week-old puppy that was diagnosed with Taenia type eggs in the feces. So this dog had adults in the small intestine. And just to camp out here a little bit and talk a little bit about the history of this dog. So the 17-week-old puppy originally presented for vomiting, maybe a little bit of diarrhea, and the referring veterinarian performed a passive fecal flotation. Didn't see any parasite eggs, and so sent the dog home. The dog ended up coming back still with some bouts of diarrhea and vomiting and lethargy. Did x-rays, thought they saw a foreign body. Took that dog into surgery, didn't find a foreign body, but they did take a biopsy of the intestines, which is right to do if you've got a dog that's got intestinal inflammation and you're trying to find the cause. And on histopath, they actually found the Echinococcus adults attached to the intestinal lining. So that's scary for me to think about when you just think about how infectious and pathogenic and zoonotic this parasite is. And so this dog was treated with praziquantel, and based off the case report, seems to be doing fine. So I hope the dog is still great. But that is just a yeah, 17-week-old puppy. So it's crazy, so young. So following along with the cases, then we had 2 more human AE cases in Vermont, with both of these individuals having no travel history outside of the US. So these infections were locally acquired. And again, this is all in areas that were not previously surveyed and thought to be negative for Echinococcus. So this is all outside of the known historical range for E. multi in the United States. And then to follow up with the 2018 case of alveolar echinococcus in that domestic dog, they did wild canine surveillance and found that 2 red foxes were positive. And then at the end of 2024, we found there was case report of 4 dogs with alveolar echinococcus out of Washington State. And then we have an anecdotal case that we'll talk about of a dog with adults in the small intestine. And then there was another anecdotal case in Kansas for a dog that had alveolar echinococcus, cysts in the liver. So all of these cases outside of the normal or the known historic range. And to add insult to injury, Antec developed a fecal PCR test called the KeyScreen GI Parasite PCR panel, and it can test for a multitude of parasites, including E. multi. And through that test, they found an additional 26 cases, again, most of them outside of the known historic range for E. multi. So because of all of this, with the increase in cases, and we've had cases that are in Missouri that we haven't found before, and cases in Virginia, we wanted to resurvey the Midwest United States, portions of it, to see what are we finding. Because one of the things that we know about this parasite is if it's a parasite that we historically thought was just infectious to wild canines like coyotes and red foxes. But if it's spilling over into our domestic dog population, then that means that our environmental contamination is high. And so we wanted to resurvey our wild canid population to see what the numbers are now. So we worked with licensed trappers and hunters who routinely trap coyotes for fur and nuisance, and we worked with them to collect their discarded coyote carcasses. So no coyotes were specifically killed for this research project. It was all opportunistic. And we collected blood, feces, and tissue samples. But more importantly, we wanted to take those intestines and scan them for Echinococcus adults. But I'm a parasitologist. I love parasites. I love working with them. I love studying them and informing the public on them. But one thing I do not want to do is contract parasites. So to make this parasite safe to work with, we froze the intestines at -80 degrees for at least 7 days, and that just inactivate the eggs and doesn't cause, it basically kills them, so they're not zoonotic to us. And so we gold standard for diagnosing these infections right now is by identifying the adults in the small intestine. So we took those intestines, thawed them, and cut them into 4 different sections, and then we cut them longitudinally. That exposes the intestinal lining, and then we put them in a jar of water, and we give them a good vigorous shake. And then here comes the scraping method. And so we take the intestines and scrape them in between our two fingers to make sure that we've got all of the intestinal lining removed. And then we take all that ingesta and we sieve it. We first remove some of the macroscopic tapeworms or parasites. So here we can see some tapeworms here in this sieve. And we take all of the liquid in the catch pan and we sieve it again. And this is going to catch any Echinococcus adults. Remember, these adults are really, really, really small. So catching all the Echinococcus adults and even the ones that are broken up, that are not intact anymore. And then we wash all that down into a 50 milliliter Falcon tube and we take it back into the lab and analyze it underneath a dissecting scope. And this is what we're looking at, which probably looks like just a bunch of nothing to anyone who's looking at this, but I wouldn't be showing you this if there wasn't an Echinococcus adult on here. And so here is the Echinococcus adult. So basically, me and my team played a game of can you spot the Echinococcus? And so this just again drives home the point of just how small these are adult tapeworms. They're not immature. These are their full size. So again, when we think about Dipylidium and Taenia pisciformis that infects dogs and how big they are, these adults are really small and very hard to see with the naked eye. And so what did we find in our surveillance? We found that out of the 53 coyotes that we collected in Kansas, 47% of them were positive. So this goes back to in the early 2000s where remember, Kansas was white in our historical map. Out of 111 coyotes in the early 2000s, none of them were positive for E. multi. And now in 2024 and 25 and 26, when we collected these samples, 47% of them are positive. And then in Missouri, we collected 52 wild canids and we found 42% of them were positive. And so all of the purple counties here are going to show where we collected coyotes and we found E. multilocularis in those coyotes. Now, Illinois and Indiana are previously been historic states for where E. multi has been found. And these percentages seem to be on par with what we found more than 20 years prior. So 20% in Illinois and 16% in Indiana is about, again, what we've seen as on par with our historical values. So no surprises there. So now that we know that Echinococcus is spreading outside of its historical range and that there are dogs that are domestic dogs that are getting infected with this parasite, now we're going to talk about what a case that we saw here at KVDL to kind of give you an idea of what Echinococcus could potentially look like in the clinic. So meet Milo. Milo is an adult male neutered Chiweenie, and he presented for a 2 to 3 week history of bloody diarrhea since coming back from boarding. And so the RDVM performed a fecal exam, or be more specific, performed a fecal float. So I wanted to take a minute here and do a not so shameless plug for parasite diagnostics. So one of the things that we like to do is we love to run a good fecal float because that is one of the main ways that we can diagnose patients, whether it be a dog, a cat, a cow, a goat, a pig, sheep, any animal. One of the best ways to diagnose them with parasites is through a good fecal exam. And the goal of that fecal exam is to, or a centrifugal fecal float, is to concentrate those parasite diagnostic stages. So we want to look for if there's any eggs, cysts, or oocysts, or even larvae, because they can float. We want to separate them from the fecal debris and allow those parasite stages to float in a good flotation solution. And so when we think about how do we get those parasite stages to float, we've got to choose a good fecal solution that's got a specific gravity that's higher than the specific gravity of the egg. So that is what's going to allow them to float. But it becomes a little bit difficult because there are some eggs that have more of a higher, that are heavier, so they have more higher of a specific gravity than other eggs. And so here we can see in this table that Taenia type eggs are more on the heavier side. So Ancylosoma or hookworm has a specific gravity that's close to water. So that basically means it'll float in just about any flotation solution. But when we're trying to target those heavier eggs, like Taenia species in this case, because Taenia type eggs can either be Echinococcus or Taenia species, we've got to go for a fecal solution that's higher, that has a specific gravity higher than of the Taenia type egg. And so what that looks like is, here I'm going to draw your attention over to the right side of the screen, is that with a high specific gravity solution, that egg will float. But if we choose something that's got a lower specific gravity, that egg is just going to sink. So I mentioned earlier about that case in Missouri where the 17-week-old puppy that had adults in the small intestine and the RDVM performed a passive flotation. There is a misconception that, well, if I'm not spinning the poop, like I can still do a benchtop flotation that just allows the eggs to passively float, and I can still use a sugar solution. And that's not the case. So sugar is very viscous. While it has a high specific gravity, it's a very thick solution. And so we really need to be spinning that poop using that centrifugation process to really get those eggs to float. So it's not just about choosing the right solution, but we've also got to make sure we're pairing the fecal technique with the right fecal solution. That's my not so shameless plug. All right, so back to Milo. So we said that the RDVM performed a fecal float. And so they found parasites, and they were seeing Cystoisospora. And Cystoisospora is a protozoal parasite that we can find in the feces of infected dogs and cats. But the RDVM found that it was treatment was unsuccessful with the use of multiple drugs. Sulfadimethoxine is going to be our go-to drug, and they also tried prenazaril and found that they couldn't quite clear this infection. But there are some things that I wanted to point out that are not quite right with this case. So when we think about Cystoisospora infections in dogs, is we normally see them in younger animals. So think about puppies. Cystoisospora, or coccidia, as it can be referred to more commonly, in any species, whether it be cattle, whether it be dogs, is more of a young animal problem or a young animal infection. So an adult dog with Cystoisospora, not that common. And they also saw bloody diarrhea. Now, we can see diarrhea with Cystoisospora, but it's more of a mucoid diarrhea instead of bloody. And then also said that treatment was unsuccessful with multiple drugs. And that's also not something that we see in Cystoisospora. So they called us up and they said, hey, I think I have a resistant Cystoisospora case. And so we said, well, we don't really see that, but how about you just go ahead and send us in some feces, let us do our in-house fecal flow, and let's see what we find. And we did not find Cystoisospora. Instead, we found Taenia type eggs. So with these eggs being side by side on the screen, you could say, well, how could that veterinarian mess this up? Like, clearly they don't look the same. And in this veterinarian's defense, I will say that every 3 weeks, I have a new rotation of seniors that come through on our diagnostic rotation. And in one of those parasitology sessions, I sit down with them at a multi-headed scope and I show them different parasite eggs, and 9 times out of 10, they're always identifying Cystoisospora as Taenia species or Taenia species as Cystoisospora. So it's I don't want to say it's common. It's a common case of mistaken identity, right? And this doesn't just happen with Cystoisospora and Taenia type eggs. Like, it happens with a bunch of parasites. So coming to the veterinarian's defense that this does commonly happen, and it's okay. As a GP, you have a lot of things to remember, and so, sometimes you don't always remember what parasite eggs look like, and that's perfectly fine. So another technical tidbit here that I'd like to add in is that if you are running in-house fecal samples or in-house fecal floats, that you can make positive controls in your clinic. It's something that I do here in the diagnostic lab. I use it to train my veterinary students. I use it to train technical staff. We even use it sometimes for CE. And so what does that look like? That looks like saving the feces, positive feces, for, let's say, Ancylosoma or Taenia type eggs or Physoloptera. You can save that feces in formalin, and that slows down the degradation process of those eggs. And so we can come back to that fecal sample and run it multiple times. Or if we've got a positive slide, let's say I've got a positive ancylosoma slide, that's what this is here, we can put nail polish around those cover slips. And what that does is it kind of seals in the moisture and kind of preserves those eggs for about 6 months to a year. Ancylosoma doesn't really last for that long, but we can keep these slides for quite a bit and we can use them to train staff off of. And so now, and you keep them in the fridge, and again, they can keep for quite some time. Now, if you say, Doc, I'm not doing all of that, like that's too much work, no worries, I got you. We also have a textbook, Veterinary Clinical Parasitology, that I love this book. It has pictures of different parasites, has instructions on how to do different fecal diagnostic techniques. And it also covers parasites not just from cats and dogs, but also from cattle, from um, equine, our small ruminants, even covers exotics. There's even some bird and reptile stuff in there. So it's really just a good all encompassing book. And it doesn't just cover fecal parasites, it also covers blood parasites and ticks and fleas and lice and all types of things. So this can be a really good quick reference guide that you can keep in your clinic if you don't want to do positive control slides. So now back to Milo. And we also mentioned that Milo had bloody diarrhea. So revisiting the case or the case reports that were published by Antec and JAVMA, reviewing their E-multi cases that they found on their key screen. And we find that out of the 26 cases, 10 of them presented for diarrhea. 2 of them reported bloody diarrhea. The other 2 reported some vomiting with the diarrhea, and 15 of those cases actually came back as a routine fecal testing. So not every case is going to fit the bill. We know this, animals have different immune systems, they get affected by parasites differently, and so it just makes diagnosis very challenging. So not only can we misidentify parasites, but not all of the clinical signs are going to match up. So another thing that makes diagnosis challenging is, I mentioned it earlier, that it's impossible to differentiate Taenia type eggs that are produced from Taenia species and Echinococcus species. So if you've got someone coming into your clinic saying they know how to tell the difference, kick them out because they're lying. Give me a call and say, are they telling the truth? And I'll tell you no. Because even seasoned parasitologists that have been doing this for like 20, 30 years can't tell the difference, right? So that makes diagnosis very challenging. So what can you do? If you're doing a fecal flotation and you're finding Taenia type eggs, in the feces of your patient or they find it in your pet and you're in an endemic area, then you'd want to consider additional diagnostics like a fecal PCR. So I mentioned earlier, talked about the Antec Key Screen GI parasite PCR panel. Gosh, that's a mouthful. IDEX also has tests as well. So Echinococcus Real PCR panel. And I like this one because if you have a suspect abdominal mass, you can send in for testing and they will also look at feces as well. And so one thing that I'm also really excited about to mention is that we are also getting in the steps to getting tests validated here at KVDL. So throughout my research and my wild canid research and surveillance, I've developed a PCR that works on my coyote samples. So coyotes eat just about anything. So if they work on my coyote feces, then I know it'll work on domestic dog feces. And so we are developing a protocol to get validated to put in our test catalog for feces and suspect cystic tissue. If you come across a case, if you're finding Taenia type eggs or you find, you're doing diagnostics and finding suspect cysts and you want to send some stuff in, we can definitely help you out with that. So it'll be coming out in a newsletter soon, I'm sure. I'm going to be working with Dr. Handelcheck on that. So another thing that I wanted to point out is I don't want veterinarians and staff and owners to get really nervous and upset about Taenia type eggs, right? If you're finding them. So one distinction that I want to make is remember that the Echinococcus adults are very small. So these are 5 adults. This is E. gran here, and this is E. multi here, and they're fitting in the end of a paper clip. So just kind of get a picture of just how small these adults are. And so, one thing I want you to be mindful of is if you're finding Taenia type eggs in the absence of perglottids. Remember, one of the ways that we diagnose our tapeworms infections is by finding perglottids either in the feces or in the environment or stuck to the hair of an infected animal. But if you're finding Taenia type eggs and no macroscopic perglottids that you can see, then you'd want to think about Echinococcus. And for that, you'd want to ask some probe on some history questions. Does your dog have a high prey drive? Do they like to predate on rodents? Have you seen them eating rodents? Look and see if you're in an area where there's either been a case report or there's been some wild canid surveillance, because then that's when you'd want to think about Echinococcus. If you have a tapeworm perglottid and you've teased Taenia type eggs out of that tapeworm perglottid, then you've got Taenia species. So if it's a dog, you have T. pisciformis. If it's a cat, you've got Taenia taeniformis. You don't have Echinococcus. Doesn't mean that it can't be co-infected, right? But if you're teasing Taenia type eggs out of a perglottid that you can see, that is Taenia species. That's not Echinococcus. So just kind of want to make that distinction there. So now back to Milo. We found Taenia type eggs in his feces. And so what did we find? We were able to molecularly confirm them as E. multilocularis. So sad day for Milo, but and she just had adults in the small intestine. So how do we treat it? Well, we use praziquantel. So praziquantel is going to be our go-to treatment for tapeworms. The mechanism of action is not clear, but we think it causes a influx of calcium ions that leads to consistent contraction, which leads to paralysis of the parasite. And it also messes with the integrity of their tegument. So it causes holes in their integument, which leads to disintegration of the parasite and expulsion from the GI tract. So praziquantel works against different tapeworm species like Dipylidium caninum, Taenia pisciformis, also Taenia taeniformis as well in cats, and also our Echinococcus species. And so one of the ways that we can protect our pets is by the routine deworming with praziquantel. And we do that by our heartworm preventatives. So not all heartworm preventatives have praziquantel in them. So if you've got a dog that likes to predate on rodents, or if you're just worried about some tapeworm infections in them, then you'd want to reach for a preventative like Interceptor Plus or Cordelio Quattro. And also, I'd like to point out that yes, praziquantel works against tapeworms, but it only works against the adult stages of Echinococcus. So remember, I chatted about dogs being able to be not just a definitive host, but also an intermediate host. And so we currently do not have any protection against the egg stages. So if you've got a dog or a patient that likes to chow down on poop, praziquantel will not protect them. And if you diagnose a dog with alveolar cysts, praziquantel should not be used for that treatment. There's another treatment that you can use, and so if you do diagnose a dog with alveolar echinococcus, reach out to an internist or a parasitologist to help you with that treatment. And so, how do we prevent animals from getting this parasite then? Education is key. Knowledge is power. So we want to inform the owners that, hey, if they've got a dog that likes to predate or likes to chow down on some poop, we probably want to prevent that. And that's going to stop them from developing cysts in their livers or in their organ tissue. And we also want to talk to them about predating on rodents and stopping that, because that is going to, that will stop them from adults developing in the small intestine and also shedding eggs in the feces, which just contaminates the environment and makes it more harmful for our owners and for other pets. And we also want to promptly pick up the feces. And this is not just for echino, it's for any parasite, because this is going to decrease environmental contamination. And anytime you're treating a dog for parasites, it's always good to follow up with a retest fecal exam, because it's a good way to assess your treatment and make sure that it's working. So, wrap it all up with some of the big takeaways. Echinococcus are zoonotic tapeworms, but the prevalence is not fully known. So, again, this is where you want to ask your history questions. If you got a dog that likes to predate on rodents, we want to prevent that from happening. Got a dog that likes to chow down on poop, we also want to stop that from happening, just because we know the parasites out there, we're just not sure of the full prevalence. If you have a tapeworm proglottid and Taenia type eggs, you've got Taenia species, not Echinococcus. Again, doesn't mean that the animal's not co-infected, but the tapeworm that you're looking at is Taenia species, not Echino. But if you suspect Echinococcus species, recommend a PCR test. Remember, you can use reference labs like IDEXX and Antech, and you can also send us some samples here at the KVDL. Praziquantel treats the adult stages only. So again, dogs that like to chow down on poop, there's really no protection there for them. And if you have questions, contact a parasitologist. We are friendly. I love to chat with people about parasites. It gives me joy to do it. And so definitely reach out, especially if you find yourself in a test treat cycle and you just don't seem to be getting anywhere and you just feel stuck. Reach out for some help. So a big thanks to everybody on this slide because they helped pull all this research together, and this presentation and me would not be here without all of these people on the slide. So a big thank you. And I like to end all my presentations with this. Can you spot the Echinococcus? So I was cleaning some coyote parasites, and so we've got Toxascaris leonina here, which is the roundworm of wild canids with the yellow arrow. And then we have Ankylostima here in the green arrow. And so now I'm going to give you like 5 seconds to see if you can spot where the Echinococcus adults would be. I think that's about 10 seconds. And so there are the Echinococcus adults. So again, just driving home the point that they are really small and very difficult to see. And so, yeah, with that, here's my contact information. If you'd like to contact me about anything parasite related, I'm here. And I'll turn it over to Dr. Hanselchuk to see if we've got any questions in the chat.
We do. Thanks, Dr. Miller. That was awesome. Even from a bovine guy, I was enthralled with this. This is a tremendous amount of good information for practitioners out there. We do have some questions. You mentioned how in your study you used minus 80 freezing to inactivate the eggs of Echinococcus. Would minus 4 or minus 7 degrees, would that inactivate Echinococcus?
Ooh, that's a good question. I don't think so. That minus 80 is really going to take it down to a very low sub-zero number. And so, no, I don't think a minus 4 would work. I think it'd have to be a minus 80. And really, at least 7 days is overkill. The WHO will say at least 48 hours, but me and my PI and my mentor at the time were not, we weren't playing around. We weren't trying to get this parasite. So minus 80 is really going to be the best.
Can cats get Echinococcus?
Yeah, cats can. Cats are an enigma, just in terms of parasites in general, but they can get Echinococcus. We don't see the infections the same as in domestic dogs. So in domestic dogs, they are kind of like wild canids too, right? Like a coyote. So we can see adults in large numbers to the hundreds to even thousands. In cats, they can get it, but they have them in smaller numbers. So while there are at least 3 case reports that I can think of off the top of my head, cats don't carry the adults in large numbers in the intestines. So therefore, they're not shedding as many eggs in the feces. So they're not thought to be as big of environmental contaminators as our domestic dogs and coyotes.
Another question, Prazi works for people, or do humans get a different parasiticide?
So they get a different parasiticide. So remember, praziquantel only works against the adult stages. And for now, there are only human reports are the cystic stages. So if you've got, for humans, the case reports have been using albendazole, and that's directly injected into the cysts. But then you have to be careful with albendazole because it can cause bone marrow suppression and all types of things. So, and I'm not an MD. So, if you think that you have echinococcus, or if you, I don't know, if you're worried about it, I would definitely reach out to an infectious disease doctor, because they would be able to help you.
Can a person get infected by eating raw edited cysts that contain the baby tapeworms?
Yeah, so there haven't been any reports of humans having adults in the small intestine. So I will say I teach this to my veterinary students. Humans have their own species of Taenia tapeworms, and that is Taenia solium and Taenia saginata, and we actually see those cycle through Taenia solium through pigs and Taenia saginata through cattle. So we call that measly beef and measly pork. Um, and so, yeah, humans have their own Taenia species. So, with that being said, there's no case reports of humans carrying adult echinococcus, echinococcus in their intestines. So, I will say I don't know on that one.
Are we seeing any resistance with praziquantel in the tapeworms?
Yeah. So we are seeing resistance in Dipylidium caninum, but not in Echinococcus.
And why? What explains the prevalence change in Kansas? It was undetected, and then how many years later it was 40-some% or whatever it was. What's the explanation for that?
Yeah, we're so we I don't want to say we're still trying to figure it out, but so what we think is that originally Echinococcus was actually in like the really early literature, Echinococcus was not thought to be um, infectious to coyotes. It was just thought to be red foxes. And not even like foxes in general, like specifically red foxes, because I haven't seen it reported in any other fox species. So, but we are seeing that coyotes are becoming the predominant host for these, and there's a couple of different factors. So there are different strains of E. multi. So we talked about a genotypic cluster for E. gran, but for E. multi, we have a North American haplotype and we have a European haplotype. So the European haplotype is thought to be more pathogenic than the North American one. And so that is why we're seeing more coyotes be infected. And because coyotes have a larger territory, they have a greater prey range, they travel longer distances. We think that is what's causing the spread outside of the historical range for E. multi. So it's kind of multifactorial in the fact that we've got a new haplotype strain, and we also that seems to be infecting coyotes. And then, coyotes are different than red foxes, and we're seeing it spread.
Another question is, do you know what the case fatality rate is for people infected with echino after it's been undetected for a long period of time?
It's high. It has a high mortality rate. I want to say 80 to 90%. And that's because it's difficult to treat. So, in the normal rodent hosts, or let's talk about E. multi, it takes 4 months for those cysts to develop. That's the natural intermediate host. But when we accidentally ingest eggs, and when dogs do, those cysts are slow growing. So it takes about, I normally say 10 to 15 years, but if they're ingesting a lot of eggs, that can mean a lot of cyst growth. I still don't know, what the 1-to-1 is. Like if you ingest one egg, like, are you going to die? I don't know that answer. Um, but we do know that ingestion of Taenia type eggs leads to cyst formation, but it's slow. And so, again, thinking about the destructive nature of E. multi in particular, and think about the destruction that that cyst can cause, because it's more infiltrative versus like a space occupying lesion like E. gran. Yeah, it becomes difficult to treat because if you're removing the cyst, you've got to get healthy margins, and depending on the organ that's affected, I mean, I think you can take out a liver of the lobe of the liver, or you can take, a lung lobe, but it just becomes more difficult.
And we have a comment, looks like from Alaska. It says that we found it in Arctic foxes.
Oh.
And we've also found E. multi in wolves and Arctic foxes in Alaska. So,
Okay, great,
so-
great. Yeah. So yeah, it has been found in wolves too. It's just I think coyote is the coyote is an opportunistic wild canid because there's so many of them, and they're a nuisance. So they're trapped and killed all the time, unfortunately. And foxes are a little bit harder to catch, and so most of the wild canid is done or surveillance is done in coyotes. It's just more convenient, unfortunately. But yes, thank you for that comment. I did forget that it has also been documented in wolves as well.
are there any other species that has been found in like cattle? Thank
So,
goodness for a bovine question. Whoever you are.
so, yes and no. So we haven't found E. multi, hasn't been reported in cattle, but cattle can get E. granulosis. And although we mainly find that in sheep, I want to say there might be another egran species that infects cattle, but I think it's more that um, s- genotypes that we find in Europe. So for cattle here in the U.S. at least, if I'm thinking about cystic structures in the meat of cattle, I'm thinking more of Taenia saginata, so the tapeworm the human Taenia species tapeworm, and not Echinococcus. Hasn't been reported yet, so yeah.
So we've got about a minute, and I've got to
Yeah.
ask this question: is in the bovine world we talk about Homuncus, Ostratagia, Capuria, some of those, and we know that there's tapeworms, but we don't really concentrate on control of tapeworms. Is that because there's really not a negative effect in animals that are infected in the bovine?
Yeah. So yeah, the tapeworm of I had to reset my brain for a minute. But the tapeworm species of cattle is Manesia. And so yeah, we do see Manesia. But no, I think that's one of the biggest things too is that tapeworm infections typically don't cause clinical signs. They kind of hang out in the intestines and absorb nutrients and things, but they don't really cause a lot of diarrhea and things like that. So most of the time, owners don't even know that their animal is infected until they're finding proglottids. And the same with cattle. I mean, we don't know that they're infected until we're finding Manesia eggs, and we normally don't find them. In large numbers. So, yeah, tapeworm infections are typically low key, and that's what makes Echinococcus different in that we are getting reports of um, diarrhea, vomiting, and things like that when we typically don't see clinical signs in tapeworm infections.
Got a couple more questions just come in the last couple minutes. So the freezing protocol for measles beef won't kill Echinococcus multi?
I don't know what the freezing protocol is for measly beef, but if it's not at -80, then no, it won't kill them.
Okay. And then there's another mention from Canada. He says got an equine surgeon who had a horse with an incidental Echinococcus detection on necropsy. Was not the primary reason, but
Yeah. I think that image that I showed, the cross section of the alveolar cysts in the liver, was actually from a horse, I think. So, yeah, it's been reported in horses, not commonly, but yeah, definitely been reported. That's pretty cool.
yeah.
I mean, from a parasitologist standpoint, sorry for the horse,
Yeah.
obviously.
Well, thank you, Dr. Miller, and thank you all for joining us today. This has been a tremendous presentation, and we'll plan on having another one. This is what, March? Have another one in May. So look out for our advertisements and our newsletters, and we'll let you know what the topic is and the presenter. So thanks again, everybody. We'll see you next time.